Good evening to those of you who've joined us right on time, right at 9 p.m. on Eastern Time. We're going to wait a few minutes just to have a few other people connect in here as we see the participant numbers go up. This is now our fifth webinar. For those of you who are just joining us, or maybe you haven't been to the previous webinars, you can hear Dr. Valentine at Latane Hospital, one of our faculty members there and a PAACS graduate, as well as Dr. Choba. He is at Bongalo Hospital, also trained there. Now he's a full faculty member. We also had the opportunity to hear from Dr. Thompson and Dr. Steffes, as well as our academic and spiritual deans. At that time, Dr. Bill Wood and Pastor Ed Scarce. Now our new academic dean is Dr. John Tarpley. So welcome again. We're glad to have each of you on this webinar, this fifth one in our series of quarterly PAACS webinars, just providing you some information and some exposure to some people that you otherwise might not meet. If you have an interest in PAACS, this is a good place for you to be this evening. So we're glad that you're here. We'll give just another minute or two. We have on our interviews tonight will be Dr. Tom Roby, our chair of our board, and Ms. Susan Koshy, the CEO of PAACS. We have the pleasure of hearing from both of them this evening, and we'll have some time for questions. We'll also have a brief update. I'll give you a brief update on what's going on with PAACS, what's been happening since the last webinar, or really over the last few months, and what we're looking towards in the coming year. Some really exciting things that God is doing as He's provided for us and improved and increased the number of collaborations that we have, number of mission hospitals that we work with, number of countries that we're in. God is really moving. Really moving within PAACS. So let me just share my screen here, and then we'll just to give each of you a brief update on where PAACS is, and a little reminder. Actually, let me say it that way. We'll do a little reminder of who we are and what we do as we jump into the top of the hour, just past the top of the hour. We will be able to hear a bit about who PAACS is, what we are, what we do, just briefly. Then we'll also hear that information from Ms. Susan Koshy, as I mentioned before, our CEO of PAACS, and Dr. Tom Roby, the chair of the board. So as we're probably having a few more people join here, let me just remind us all that PAACS is the Pan-African Academy of Christian Surgeons. And our statement here is seeking to educate with excellence and to evangelize a continent. Don't we all need to hear about Jesus? Our vision. PAACS envisions a growing number of African surgeons and related specialists living out the gospel and ministering to the sick. We'll come back to the related specialists at the end of our time here. And PAACS mission is to glorify God by training and discipling African surgeons and related specialists to become Christ-like leaders and servants, providing excellent and compassionate care to those most in need. 2 Timothy 2:2, I think, captures what PAACS does quite well. And these things you've heard from me these things you've heard me say in the presence of many witnesses, entrust to reliable people who will also be qualified to teach others. And that's what we do. We pass it along from generation to generation, from person to person. And on the surgical side, what do we say? See one, do one, teach one. And that is the essence of PAACS. But tonight, we have the privilege of hearing from our CEO first, Ms. Susan Koshy. I think you are going to be thrilled to hear what she has to say about her perspective on PAACS, the time that she's been with us. So let's hear, as I stop sharing here, so Corrine can start sharing. Corrine, if you can cue that up, and we can hear from Ms. Susan Koshy, PAACS CEO. Ms. Koshy, welcome. It's so good to have you on this PAACS webinar.
Well, thank you. It's a pleasure for me to be here.
Ms. Koshy is our CEO of the Pan-African Academy of Christian Surgeons. She's been in that role now that we're independent for just over a year, but has been the director, really in charge of PAACS for now 5 years, or just over 5 years. It's great to have you on. We have just a few questions. We'd love to hear your thoughts about PAACS. How did you first hear about PAACS, and how did you end up in this role?
Well, that is truly, Kier, a God story. I've been with PAACS now. It's a little bit less than a total of 7 years. And back in 2013, I had been working with my previous organization for about 16 years. But I felt a real stirring in my heart at that time that God wanted me to serve him. But I didn't know where, I didn't know how. So I went on a time seeking the Lord. I went into a time of fasting and prayer, seeking his face on this. And during that time, I really felt within my spirit, God was saying he would open a door for me to be able to serve him.
Wow.
Now, I'm a person of faith. That's one of my gifts. So, and as I said, I've been with my previous organization for about 16 years. So in faith, I started clearing out my office. Every weekend, I would take home photographs, paintings, and knickknacks I had in my office. So soon my office became quite bare. But even in this time, no door was opening. So I continued to seek God about this. And I really felt very strongly in my spirit, God saying to me, I want you to step out of your comfort zone. And I want you to take a step of faith, step out of that boat of comfort and walk on water. I want you to resign your job without another job in sight. Now, that was really beyond my comfort zone because at that time, at that season, I had a son who was in college and a second one getting ready to go to college. It was just not the right time for me to resign my job. But with my husband's blessing, I decided to take that step of faith. I stepped out of the boat and I went and resigned my job of 16 years and I had no other job in sight. And as part of my resignation, I had to go down to New Orleans, Louisiana, to complete some meetings. And when I was in New Orleans, I was just walking past a coffee shop and I heard someone call my name. And I went in there and it was a surgeon friend of mine that I had worked with. And I knew he was a Christian and he had seen an email stating that I had resigned. So he asked me, so, what are your plans? What do you plan on doing next? So I told him, I really feel that I need to go and serve God. And then he asked me, in what capacity? What do you plan to do? And I really felt that God was calling me to come and to run an organization that would bring glory and honor to him. And then his final question to me was, where do you feel like you're called to serve? And I'm from East India, but I've never felt a call to go back to India. But I really felt a pull and a call to Africa. So I told him I really felt God was calling me to serve him, doing something in Africa. And he looked at me with this very incredulous look and he said, you won't believe this, but I happen to sit on the board of directors for a surgical and discipleship training organization that works in Africa. And we are starting to look for somebody. We are just starting the process to look for someone to come in and run this organization. So that was my first exposure to PAACS. So he contacted me a few weeks later. I threw my name into the hat and eventually I was selected for this role. But I would say that I may not have been the most qualified candidate, but I say that God does not call the qualified. He qualifies the called because he gets the most glory from there. And so it's been my privilege to work alongside of some incredible people in this ministry and to be able to shepherd this ministry over the last several years.
Thanks, Susan. That's a great God story. It's got his hands and his fingerprints all over it. And it's an encouragement to all of us that when we step out in faith, what God can do. What excites you about what you do?
So I love the fact that this is a ministry that is focused on prayer and that I have an opportunity to pray openly with everyone from the board of directors to our residents, to our faculty, to our administrative staff. And everything within this ministry is really bathed in prayer. And another thing that just really excites me about PAACS is the fact that Christ is the center of this ministry. And he truly is the leader of this ministry. And he's the one that goes before us and makes the path clear for us. And I love that. Another thing that really excites me about PAACS is when I get the opportunity to hear from our faculty and from our residents and graduates stories about how they are impacted by the PAACS ministry and how their patients and hospitals, their communities are impacted by PAACS. So it's such a blessing for me to work for a ministry that has such an impact on the lives of people in Africa. And not only that, it has an eternal impact. Mm-hmm. And that's what I would say truly excites me about my role.
That's great. That's great, Susan. Thank you so much. Along those lines, so if that's what excites you for what's happening today in PAACS, what are some things that you see as needs and those next steps?
Well, let me break it down. Let's talk about first the needs. So prayer is always a need. We covet prayer, and that is definitely what's impacting this ministry the most. But if I were to pick two, what I would consider two of our greatest needs, one I would say is our need for faculty. We really need more faculty in our programs. And I know with this pandemic that has really served as an obstacle for PAACS. But I would really say that PAACS needs men and women who are called by God to come and train our residents. But not only just to train, but these, we're asking for men and women who want to really share their lives and share their skills and their experiences, their talents with these incredible residents that are a part of the PAACS ministry. I would also say we need faculty who are excited and who have a passion to disciple these residents, because these are going to be the future surgical and spiritual leaders of their hospitals, of their churches, their communities, and even of their countries. And these are the men and women that are going to truly impact Africa, and they're going to change the spiritual landscape as well as the healthcare landscape of this continent.
Sure.
So that's one. Two, I would say we need a diversity of leaders in the PAACS organization. Mm-hmm. I would really encourage more women to get involved. We need younger people to get involved. We'd like to see diversity in our leadership. I would encourage church leaders to get involved, business leaders to get involved in the PAACS leadership. You do not have to be a surgeon to participate or to engage with PAACS. God is really blessing the PAACS ministry in terms of our expansion. We are expanding into more countries. We are expanding in terms of partnerships with mission hospitals. We are expanding in terms of also in terms of surgical training programs. And we're going to see this expansion within the next several years. Mm-hmm. But the PAACS leadership, the PAACS board of directors and the administrative staff, as they're looking at this expansion, I see that there's tremendous wisdom. And what they're doing now is we are in the process of developing a 5-year strategic plan. And this plan is our roadmap for the PAACS organization as we move forward with growth and with whatever needs to be done with this ministry in the next several years. But what I think has been very critical about this strategic plan is not only are we looking at expansion, a roadmap to expansion, but this, the leadership, the board of directors, the administrative staff through this strategic plan is looking at strengthening the components and the elements of PAACS as they already exist. We're looking at making the PAACS ministry in terms of our programs that already exist stronger. We want our roots of PAACS to go deeper and then strategically expand. So just to give you a bit of a summary, I would say over the next several years, you're going to see a much stronger PAACS ministry, stronger in terms of our academic and spiritual offerings. We're going to see we'd like to see even more of our residents become faculty and provide training for them so that they can become faculty. We want to strengthen the current faculty that we already have by providing more professional development for them and training in terms of discipleship. And then we want to expand. And as I said, we want to sow strategically into countries that have a need for more surgeons and so into countries that really need to be reached for the gospel. So that's where I would say are our next steps for the PAACS organization.
That's great. Those are exciting and really God-sized visions. Thanks for sharing that with all of us. As we bring that to this interview to a close here, what would you say to someone who says, yeah, that excites me, I want to get involved? What would be their kind of next step? How could they get involved with PAACS?
Well, I would always encourage pray first and see what God would have for you and how God would want you to engage with us. Two, I would say go and look at our PAACS website because there's a lot of things that people might want to do and be a part of PAACS, and it'll show you how they can probably engage with us a little bit more. I would also suggest that they sign up for the bulletin, because the bulletin is a wonderful way for you to learn what's going on in our various PAACS programs and within the PAACS organization. I would also suggest that people potentially contact either myself or you, Kier, so that they can have a discussion with us and learn more, and maybe even come and be a part of one of our PAACS board meetings and start engaging in our committees and our councils. And then if people feel called to be a PAACS faculty, and I would say it's usually a calling from God, and maybe potentially go on a short-term mission trip and visit one of our PAACS sites, or maybe go and visit multiple PAACS sites. And I would also be remiss if I didn't say, in other ways, please pray for this ministry. I mean, invest in this ministry, invest in us through prayer, and also invest in us financially, because it is through financial investment that we are able to sustain ourselves and also to grow as a ministry.
Ms. Koshy, thank you so much for your thoughts on the organization of PAACS and how you've led this organization over the last now almost 7 years. And we look forward to seeing what God's going to do with PAACS in the future. And as Ms. Koshy said, if you're interested in getting involved, please contact us. We're available. Thank you again, and we'll be available for questions here in just a few minutes.
Thank you, Kier.
Ms. Koshy, welcome. So I hope that you were all enlightened a bit about PAACS and encouraged by Ms. Koshy's comments, our PAACS CEO, as she shared about prayer, as she shared about our strategy, which begins with prayer, but also our roots going deep and broadening our impact, and ways that you can get involved. We would love to have you get involved. Now we're going to hear from our chair of our board, Dr. Tom Roby. Tom is someone that I've known for quite a number of years, and I think Rachel has that interview ready to go. So Rachel, if you could pull that up, that would be great. And we'll hear from Dr. Roby. After we hear from Dr. Roby, then we'll have a chance to have some questions. So let's hear from Dr. Tom Roby. Dr. Tom Roby, welcome. We're thrilled to have you on this interview today with PAACS. Just a little bit of background about Dr. Roby. He's a pediatric ENT, works up in Wisconsin. He's been involved with PAACS actually for over a decade now. Tom and I met first at Bongalo and have gotten to know each other over those years. And I've been really thankful for your leadership as the chair of the PAACS board. But let's back up a little bit for the first question that I would have for you tonight. How did you first get involved with PAACS?
Sure. Well, thanks, Kier, for having me on. And I actually remember it pretty well. It all started with an email. I was in private practice doing pediatric otolaryngology up in Milwaukee, and it was 2005. And I remember I got an email, this random email. I don't know why I got it. And to this day, I don't know why I got the email, but it was from Dave Thompson, and the founder of PAACS. And it was an email that I think he sent out to most likely many of the surgical members of the Christian Medical and Dental Association at that time. So I think that's why I got the email. And he was just explaining what PAACS was. PAACS was in its infancy at that time. He had his own training program at Bongalo. And he was just inviting people to get involved with PAACS, and specifically that he needed surgeons to come and help train his surgical residents. And so I remember I replied to the email, and I remember I told him, I said, I'm not a general surgeon, but would you ever want someone to help train your residents in ENT surgery or head and neck surgery? And if that was the case, I would love to come. And I remember he sent me an email back. He said, hey, we need you. And that was the first time that I learned that to be a surgical resident with PAACS meant that you were covering everything beneath the skin. It didn't matter where it was in the body. You were responsible for doing it. And Dr. Thompson just explained how important it was to have subspecialists come and really train his residents in whatever area that was your expertise. And so, I decided I was going to go. And so next thing I know, I'm looking for flights to Gabon. I had no idea where Gabon was. I had to look it up on a map. And remember having a discussion with my wife saying where I was going. And she was like, where, what, and I said, I was so excited to have that opportunity because up until that time, most medical mission organizations, it was all centered around primary care. And to be a surgeon, you wanted to be able to use the gifts and abilities that the Lord's blessed you with. And PAACS was like just this amazing opportunity. And so I jumped right in and I went off to Gabon and started to do it year after year. As you mentioned, that's how you and I met. Mm-hmm. And really enjoyed being part of the teaching faculty for PAACS.
That's great, Tom. Thanks for sharing us a bit of what really is God's story and how He's directed you to be involved with PAACS. Let me, in some sense, broaden out a little bit the question. Your role as chair of the board started just about 2 years ago. For those who don't know, 2 years is the term for the board chair. And what has excited you about taking that role? Like, who wants to be the chair of a board? And maybe share also some way that God has used that role to impact yourself.
Yeah, I think, the being the chair of the board, that was sort of the end result of sort of a process that's been going on since 2008. So I guess another good question to ask is, why have I stuck with it? Because I've been on the commission of the board since 2008. And I just love PAACS. I mean, I think it's an amazing ministry that has so many touch points and is affecting an entire continent. And so to be a part of an organization where you see God sort of working in so many people's lives on so many different levels, it's not just about training surgery residents who then go off and do what you've trained them to do, but it also involves mission hospitals in all these various countries sort of being elevated to a new level of care because they have a PAACS training program there. It involves the impact on local cities and villages where people are employed by these mission hospitals. They're employed as part of the PAACS training program. There are nursing schools that pop up at these hospitals and are training nurses. And so you see not only a local sort of community effect that the Lord is having through this ministry, but then you see the national impact where entire countries are being changed. And then not only on a national level, but then an entire continent is being touched. We have graduates who are now serving, I think, in 21 or 22 different African countries. And they're not just doing their surgical work. All of this is sort of enveloped in the gospel of Christ. And so you have them then taking the message of Jesus Christ to wherever they go and sharing it with their patients. You have these mission hospitals who every day are starting their workday with all their employees gathering for a Bible study or a time of praise and worship. And so for all those reasons, it's just been for me one of the biggest joys of my life. And I get really excited when people ask me about why I do PAACS.
That's great, Tom. Thanks for giving us a bit of your personal story and how this has impacted you and how this call to be involved with PAACS started over 15 years ago, and 13 or so, I guess, on the administrative level, but over 15 years ago, your initial contact with PAACS. So in those 15 years, we'll say, or the last 13, you've seen the organization grow. Now with your leadership over the last couple of years, we've even seen ongoing growth, I should say. And we have some other initiatives and areas of interest or focus. What would you like to say to the PAACS family about your thoughts on the future of PAACS?
Yeah, great question. I think one of the things I would say about PAACS is it's a very dynamic ministry. It has not been static at all, and it's adapted, I think, well to not only things that are going on in the world, but also we've been very sensitive when we feel that God's calling us in sort of a new direction, but at the same time, we've been very careful to make sure that we understand our mission and that we don't get involved with mission drift. So I think what the next 5 years are going to look like is I think we'll be a little bit more strategic in where we open up new programs. I think we're a big enough organization now that we've learned from our mistakes. We've learned from, just lessons we've learned over the last 20 years, where I think we're now getting hopefully more focused and better at deciding where a program should start and in what country would PAACS, make a big imprint. And so I think that's exciting. And then I think we are now been doing this long enough that we're realizing the value of getting our PAACS graduates into the leadership positions, not only as program directors and associate program directors, but as faculty. We now have PAACS graduates serving on our board of directors. We now have PAACS graduates who are serving on many of our committees. And that's really exciting because we have people that have gone through the entire training program. Who better to train PAACS residents than someone who has gone through the program itself and really understands the challenges that Africa brings? So I think those are the two things that I think will sort of be highlighted as we go forward, is being more strategic in where we're working, and also involving our colleagues in Africa and our own graduates on a greater extent from a leadership standpoint.
Thank you so much for all the information you've given us, just your perspective. As we round out our time with this interview this evening, let me ask this final question. Someone who's maybe just dipped their toe in the water of PAACS, what would you say to them in terms of future engagement? How would you kind of frame it, or how would you encourage them or challenge them regarding future engagement with PAACS and maybe a deepening engagement?
Yeah, my answer to that is it's time to jump in. If you're a toe dipper and you're standing there wondering, it's a big pool. What's really cool is PAACS is a big enough organization now that there are so many different areas to get involved with, depending on where the Lord's gifted you and where you feel His calling. Some of the ones I'd like to highlight, we always need teaching faculty. So if you're a surgeon or if you're an anesthesiologist, if you're a medical proceduralist and you want to help train PAACS residents, we have a place for you. We have, I think, nearly 18 training programs now where a good part of that training is done by visiting surgeons. If that's something that excites you and that's something you want to be a part of, then we would definitely find places for you to serve and help you sort of get established in that. If you have administrative gifts and skills and you'd like to get involved with PAACS, we would like to invite you to come to one of our meetings. We'd be happy to have you serve on one of our committees and to meet some of the people both in the PAACS administration and on the board of directors. And we're always looking for new people and younger surgeons and just people who are looking to get involved with missions. PAACS is a great opportunity. If you're the type of person that likes to write a check, we'll take your money. We'd love to have, what an investment. You can invest in these men and women and in their training and in their teaching, and you will have a lifetime return on that investment. of men and women going out and bringing not only excellent surgical care, but sharing the gospel as they do it to areas of the African continent that's just so badly needed. And so we'd be happy to have you partner with us in that way. And then lastly, if you're a prayer warrior, we would love to have you on board with our prayer team. We'd send you one of our prayer journals. It highlights all the people in PAACS. There's a different program and a different person to pray for every day. And we would just covet those prayers. We understand that none of what we're able to do is done without the Lord's help and his leading and his guidance. And so we really would appreciate people's prayers that the Lord would continue to bless the ministry, that he would continue to guide us, that he continue to show us where we need to get more involved. And so there's so many areas. I would just tell you, jump in, find an area that you're comfortable with and jump in, and I promise you won't regret it. And it's just a wonderful group of people and a great organization to be a part of.
Dr. Roby, thank you so much. Thank you for your dedication, for your loyalty to PAACS, for your answering the call to be involved, to take that first trip that you weren't so sure about maybe, although you were excited. But thank you so much for your leadership, your ongoing engagement, and your vision for this organization. Really appreciate your time. And if there's questions, we're going to have a time for answers and questions and answers later in the webinar. So feel free to do that. Dr. Roby will be available for those questions as well. Again, Tom, thank you. Really appreciate your leadership. Thank you as a friend, and look forward to seeing what God's going to continue to do with you and through you for PAACS.
Thanks, Gary. Happy to do it.
I hope you were blessed to hear from Ms. Susan Koshy and Dr. Tom Roby. I'm blessed to work with both of them. I would like to highlight just one link that I noted in both of their interviews. And by the way, they didn't talk to each other ahead of time. So those answers, I think, speak to the continuity and the cohesion of our team at PAACS and the vision that God has given us. But I'd also like to note that both of them, their first experience with PAACS was an invitation from someone else. So if you're on this webinar and you want to join on the next one, invite someone. Invite someone to be a part of what PAACS is doing, which you're maybe already a part of. And if you're not fully a part of it, join us. I invite you right now to join us. So as you're thinking of questions for Dr. Roby and Ms. Koshy, let me just share my screen yet again here and give a few updates, some current events, if you will, with PAACS, as well as a couple of comments about what the future may hold for this organization in the coming months. We're not talking about strategic planning here in this aspect that I'm going to share with you. That's what Dr. Roby and Ms. Koshy have already shared with you about strategic planning, about the importance and the foundation of this ministry being prayer. So we would invite you to pray for us and to pray for the residents and to pray for this ministry. I do want to note that I'm thrilled to welcome both my wife and my kids. My son is on from Wheaton College. I'm just going to take advantage of the opportunity to say welcome, Luke, and to your friends as well. So a couple of updates about PAACS. PAACS exams took place in June and the end of July. We had a very good success on those exams. Those are exams that we prepare. Some had to take the remediation exam, and we felt that it was a very well done exam. Very thankful to Dr. Bruce Steffes and Dr. Carl Heisch and Dr. Steve Doan participated in that. The COSEXA exams just took place the beginning of this month, the written exam. We had everyone so far has passed except one. That's a really high percentage of passing, over 90% of passage, both for the MCS and the FCS. And we're very proud of our residents and all the hard work that went into them being able to be successful on those exams. A couple updates about applications and interviews. Often people say, well, if this is a program, how coveted or do people want this program? We had about 40 open slots coming for 2022, and we had over 340 applicants for those 40 spots. So it's just over a 10% acceptance rate of the applicants. We think that's pretty good, especially when we look back a decade or more and we remember years where we had the same number of applicants as we did spots. So God has really brought some renown to this program, and it's become a coveted program, not just because of the quality of the academics. In fact, more importantly, because of our intentionality of discipleship. I also should give you a brief update on Brackenhurst. This is a conference we usually hold at the beginning of the year. COVID did not allow that to happen. And sadly, our October plans have also been postponed. We will now not be holding this Brackenhurst conference until early next year. At least we hope it will be early next year. And we appreciate your prayers for wisdom on when to hold the conference of what turns out to be about 100 people at this conference center. As Dr. Roby mentioned and Ms. Koshy about the future of PAACS, one of the aspects of the future is growth. And so in January 2022, we're looking to add Incoma Mission Hospital. Things are moving forward. I don't see any reason, Lord willing, that program will open. HVMM, or Opitali Vauvau Mahafali Mandritsara, now you know why I said HVMM, in Madagascar, will be opening as well. Again, we see no problems with that program opening very soon in January of 2022. Kubuye Hope Hospital in Burundi has just submitted their application to the Ministry of Higher Education. We would covet your prayers. They would covet your prayers for a positive reception of that, what we call dossier, as the authorities are reviewing that. Let me also mention that in January of 2022 at Tenwick Hospital, we will be adding obstetrics and gynecology training, as well as at Kajabi Hospital, anesthesia training. That anesthesiology training at Kajabi Hospital is also in the midst of getting approval from the authorities and the government. So please be prayerful about that. And then surgical endoscopy, a one-year fellowship, will be starting in January at Tenwick Hospital as well. See a question mark there by plastic surgery. We're not certain about number of faculty, if we have enough, or if we'll be able to start that fellowship, which would also be at Kajabi. So God is moving. Those additions, if we add all 7 of those programs, that takes us from currently 17 programs and 10 general surgery, so a total of 17, to what would be 13 general surgery programs and overall 24 PAACS training programs. God is doing amazing things. So now, time for questions. And as you're rounding out what those questions may be, pray for PAACS. We would ask if you want to invite someone, become an ambassador. If you want to go, we would love for you to go as well to one of our sites, or you can give online, and please visit the website. So let's jump into what these questions are. Tom and Susan are here available. Dr. Roby and Ms. Koshy are here available. What kind of questions do we have here? I'm not seeing a question. Oh, here we go. We have a question. Question for Susan or Tom. If you have one, please put it in the Q&A. Actually, that's what we were telling you. And I don't see anybody asking questions. So please, you must have a question. Ask one. If you don't have a question, then I'm going to make up a question. And you've heard enough of my questions already. Any questions out there, please put them in the chat. Get a question from Jeremy Powers. I don't know if Tom or Susan wants to take this one. What is MCS and FCS? Or if you want to defer, you're welcome to do that as well.
Well, I'll let Kier get into the specifics on that, but it's sort of the junior versus senior level of residents and their the exam that they take at different parts of their residency. But Kier, being the general surgeon, can give us the specific details on that.
I think you did a great job, Tom. You're right. The MCS is 2 years, FCS is 3 years, generally, following that MCS. Yeah, good. Other questions that people might have, feel free to type them in. One question that I may have, if either of you, as you have now had a little bit more time to think about the interview, is there anything that you would like to share with regard to strategy? You both mentioned the strategic initiatives that we're redoing that. We have a 5-year plan that we're going to be looking at the board. Is there anything for this evening for the people who are on this webinar that you might want to expand on just for a minute or so? We have just a couple of minutes. If either of you would like to just maybe answer that, as I'm putting you a little bit on the spot, but I think you have an answer. I'm sure you do.
Yeah, I guess the important thing to point out is that the strategy is not just where to open up PAACS programs. The strategic plan involves what are our strategies when it comes to our spiritual curriculum over the next 5 years. What is our strategic plan for identifying PAACS residents who will be outstanding leaders, and what sort of leadership track can we develop for those residents. Another area is how well are we preparing our faculty and program directors for the job that we're asking them to do? So what do we need to do to invest in our leaders before they head off to the field? So those are just some examples where it's not just where we're opening up programs, but how can everything that PAACS does, how can we do it better and in a more strategic way?
As I mentioned earlier during my interview, this strategic plan focuses not only expansion, and I would say that what we focused on there in terms of expansion was strategic expansion, but we're looking at how do we strengthen what we already have? And those are the components which Tom already spoke about. So this strategic plan has been 9 months in the making, and this has been a cooperative effort from not only from the board of directors, but also it's been a team effort with the PAACS administration. So we've put together a strategic work group who has gone through this and also worked very closely with the PAACS administration. And this strategic plan is currently ready to be brought before the full board of directors for their review and approval. And we hope to have it implemented sometime in October.
That's wonderful. Thanks, Ms. Koshy. Thanks, Dr. Roby. There's another question here, and I think Susan, Ms. Koshy, I'll put this one for you. What has been the impact of leaving the CMDA organization? I imagine, Dr. Roby, you could answer that as well, but I think from a CEO perspective is probably what they're looking at in terms of an answer to that question. So if you're ready, go right ahead.
Certainly. So PAACS was under CMDA for close to 2 decades, and CMDA provided us with tremendous wisdom. They provided us resources and expertise. And so it came to a point where PAACS actually grew large enough that it was time for us to step out of the nest, out of the comfort zone of under CMDA. And it was a 1-year process where we worked very cooperatively with CMDA into becoming an independent ministry. It's a continuing growing process. We just celebrated 1 year as an independent ministry this past July. It was a growing process. There's been a lot of challenges that came with this because COVID came along about the same time that we became an independent ministry. But God has been leading us. He has blessed us. This, even though we did separate from CMDA financially, this has been one of the best years we've ever had. We are growing and expanding into more countries. We are going to be having many more programs, as Kier has indicated. So there has been tremendous blessings because we have stepped out, and it was simply because it was time, and we've grown into such a large organization. But we're truly grateful to CMDA for over two decades of just coming alongside of us and partnering with us and helping us to get to this point where we could become an independent ministry and serve God and continue to impact Africa.
Thanks, Ms. Koshy. I'm going to ask this other question while I answer another one. So be thinking about how you would describe the future growth projections and the vision over the next 5 years. If you want to defer about growth, often that can be something I end up doing, but on the vision side, so what would you describe as the future growth projections and vision for the next 5 years? And there's another question here about how COVID has shut down many things. How has PAACS' strength regarding coping with COVID, how has that been evident? And I think there's some real ways that God has provided PAACS as a strength during this time of COVID. If either of you would like to take either of those questions, feel free to go ahead and just unmute and take the one that you're feeling most passionate about answering. And we'll end with those 2 questions. So maybe the question about COVID, if you have that one, and then we can talk about the growth and vision as a good place to end. So about COVID.
I can talk about the vision. I think one of the, advantages of being a standalone ministry now is we need to look for partners. And CMDA continues to be one of our biggest partners, but it also allows us to partner with other ministries, both in the West, but also in Africa. And I think one of the visions that PAACS has is how do we partner with other ministries throughout Africa to improve the overall healthcare of the African people, not just from a surgical standpoint, but is there a way that we can partner with those who are in primary care, those in hospital administration, and what is the role that PAACS plays in that? Do we provide some leadership? Do we provide what we've learned to help other programs that are in Africa as well? And so I think that's one of the exciting potential strategic visions that we have. It will be more than just about surgery. Surgery will still continue to be our main component, but how do we take what we've learned in the continent of Africa and our leadership, and how do we partner with other ministries to really improve the healthcare for entire countries and for the entire continent?
Thanks, Dr. Roby. Ms. Koshy.
With regard to COVID, I can speak from it about it from a administrative perspective. And Kira, if you'd like to speak about it from a program perspective, that would be great. So administratively, COVID impacted us in the fact that we were unable to meet. We, our PAACS Board of Directors and leadership for the past year have had to meet by Zoom, but virtually. But God has provided a way for us to continue to meet. And unfortunately, we have not had the ability for the last 1 year to meet in person. But in Chicago, in October of this year, we are going to be having a hybrid meeting, October 15th and 16th. And I would welcome many of you to come and participate. So people have an opportunity to be able to meet in person in Chicago if you feel comfortable, but we also are providing a version where people can join us virtually. So this is one of the impact that we've had because of COVID, but this has also been an opportunity because we've opened up our meetings, all of our board meetings. And we've been able to have people from Africa, from Australia, from Canada, from the United States join in these meetings. We've had over 100 participants in these virtual meetings in the past year. So what could be seen as a challenge ended up being an incredible blessing for us. That we're able to truly, I would say that chasm between the North America and Africa we've been able to really reduce that chasm. And so that's one. Two, another challenge with COVID has been fundraising. Usually we're able to fundraise in person, but once again, God helped us and provided us with unique opportunities to be able to fundraise, and we were able to do it using, once again, Zoom virtually. We were able to even hold fundraising events, peer-to-peer events, and we had several of them. I believe we had about 7 virtual peer-to-peer events, and God blessed us once again, and we had one of the best, actually the best financial year that we've ever had. We beat records, even with COVID. 6 months in 6 months, we've had records of the best fundraising months that we've ever had. So that was also an incredible blessing. And so we've had challenges, but God has helped us even through COVID to overcome all of these challenges. So Kira, I don't know if you have anything that you wanted to say about the programs in COVID.
I think you said it well, and I'll just tag on from the program's perspective, that chasm that you said between the United States and Africa, where most of our administration is in the US, has now shrunk. It's forced and fast forwarded some virtual online and learning opportunities that were in the works, but weren't really forced to happen. But now they've had to happen, not just in PAACS, but other areas. And we've been able to build on that. It's allowed us to get together as groups on Zoom, which we were not able to get together in person across Africa. And we didn't have the technology before, but now Zoom has become available as other modes of technology like WhatsApp to allow a connection. And so the strength regarding coping with COVID from the question here, what is PAACS' strength, is that it's allowed us to remain connected with Zoom in ways that maybe we would never have connected if we didn't have this challenge of COVID. So thank you, Dr. Roby. Thank you, Ms. Koshy. We really appreciate hearing from both of you and your hearts for this ministry and how passionate you are about PAACS. God is doing some amazing things, and he's used both of you to impact a continent, really a continent. I don't think that's an exaggeration, to impact parts of the African continent through this organization of PAACS that you have led and been a part of for a number of years, each of you, in your engagement. We look forward to it for many years in the future and to see what God is going to do using both of you as leading within the PAACS ministry. Just as a reminder for those of you listening and to this webinar, there are other webinars on the website. You can access them. And Rachel, if she hasn't already, can put in the link to that. You can see that in the chat. Webinars with Dr. Valentine, Dr. Choba. We've had Dr. Steffes and Dr. Thompson. We've had the academic dean, Dr. Bill Wood at that time, and our spiritual dean, Pastor Ed Skierce. So if you want to go back and listen to those, check out the website, PAACS.net, PAACS.net. And if you have any questions, please don't hesitate to find us on that website and shoot an email to me or to Ms. Koshy or to anyone else within the PAACS organization. You can do that at info@PAACS.net. That's another way to reach us. That's just info, info@PAACS.net. And let me just pray for us as we close this evening. Lord, we thank you for this time to hear from Ms. Koshy and Dr. Roby, from our CEO and our chair of the board. Lord, we thank you how you have called them to this ministry. They may not have felt equipped at the time, but you've equipped them along the way. You've done the work. Lord, thank you for their hearts for you, their dedication to you, their commitment and their obedience to you to serve in this ministry. And Lord, I want to just ask for those who may be waiting for that invitation, that they would know that you've invited them to engage with PAACS, that toe that they were dipping in the water, they should just jump on in, as Dr. Roby said. Lord, thank you again for each person on this call this evening, on this webinar, that's been listening in, that's been watching. I trust, Lord, that you have met them in a special way this evening, that has encouraged them, that has challenged them, and has given them some tracks to run on for the future as they engage with PAACS. Lord, thank you again for Ms. Koshy and for Dr. Roby. We pray these things in Jesus' name. Amen. Have a great night, everyone. Great to have you on. Thank you so much.
Thank you, Kier.
Thanks, Ms. Koshy, and thank you, Dr. Roby.